In this video, we'll talk about the Helicobacter pylori infection. Helicobacter pylori is a bacteria and it infects the stomach that can cause ulcers. About half the world population has Helicobacter pylori in their stomach, but not all of them show symptoms. So let's understand what are the symptoms of Helicobacter pylori infection. So the general symptom is ache and burning sensation in the abdomen, and it worsen with the when the stomach is empty. Other than that, nausea, loss of appetite, bloating, and weight loss is kind of other symptoms of Helicobacter pylori infection. Let's talk about the transfer route of Helicobacter pylori. It could be fecal oral, gastric oral, it could be waterborne, and in rare cases it could be oral or zoonotic mediated transfer. So once Helicobacter pylori enters our body, it survives the harsh environment in the stomach, and it kind of erodes the lining of the stomach, and ultimately it leads to formation of an gastric ulcer or a duodenal ulcer. Now let's try to understand the ulceration process in bit more details and how Helicobacter pylori can survive in the harsh environment inside the stomach. Here is the gastric mucosa, and you can see the mucosal lining which contains of several epithelial cells and several other cell types. Now this is the thick layer of mucus, and even beyond the layer of mucus there would be gastric HCl in the stomach. Gastric HCl actually kills other bacteria, but Helicobacter pylori can survive in this extremely low pH environment. And let me tell you how. Helicobacter pylori actually produces one enzyme known as urease, which actually buffers the acidic environment inside the stomach. And let me tell you how. So the urease enzyme can convert urea into ammonia, and ammonia being basic can buffer the immediate surrounding of the Helicobacter pylori, and it can create a somewhat basic environment that allow the Helicobacter pylori to survive. Other than that, Helicobacter pylori expresses some adhesion molecules known as adhesins. This help the bacteria to attach to the epithelial cells and infect them. Helicobacter pylori has tufted flagella which helps in chemotaxis and penetrate this thick layer of mucus. Other than that, Helicobacter pylori secretes VAC-A and CAG-A, which are two cytotoxins which are responsible for the infection and the pathogenicity of this bacterium. So VAC-A can bind to the membrane of the bacteria and work as a adhesion molecule, so it allows the surface adhesion of this bacteria. VAC-A can also bind to specific receptors on the gastric mucosal cells and ultimately lead to an inflammatory signal, and it leads to production of inflammatory cytokines which brings out inflammation in this local region. VAC-A can also bind to the mitochondrial membrane and allow the leakage of cytochrome C. So when cytochrome C is released, apoptosis is kind of triggered. Now we understand in the gastric mucosa there would be apoptosis of the cells, there would be inflammation, and all these lead to further inflammation and leaking of the gastric HCl into the mucosa, which ultimately leads to the ulcer formation, and it gives you that pain sensation when your stomach is empty. Now let's talk about the diagnostic tests for Helicobacter pylori, how it is diagnosed. There are a few tests such as blood test, which checks the antibodies of against H. pylori in your blood. There is breath test. There are several biomarkers in the breath which can give us a sense that whether you are infected with H. pylori or not. There could be also stool test, where you provide your stool samples and the antigen test looks for Helicobacter pylori antigen in the stool. But the best test for Helicobacter pylori is endoscopy. Here the doctor enters endoscope through your alimentary canal and try to visualize what happens in the stomach, and he takes a small portion of the stomach, and that is then sampled for or assayed for Helicobacter pylori. So there are small strips available and which is used to perform urease test. As I have mentioned already that Helicobacter pylori has urease enzyme. So obviously here in this particular spot there is urea. So if there is urease, there would be ammonia production, and the indicator which is present in this spot will change the color. That simply boils down to, if you have red coloration, that means you have Helicobacter pylori infection and it's positive. But if the color comes to yellow, that means you don't have any infection. This is how we can rapidly understand whether there is an infection of Helicobacter pylori or not. Let's talk about treatment option. So obviously it's a bacteria, then the treatment option is antibiotics. But along with antibiotics, proton pump inhibitor can reduce the acidity in the stomach and it can relieve the symptoms of ulceration. Among the common choice of antibiotics, amoxicillin, then clarithromycin, metronidazole, and tetracycline are